Hi, hi, welcome. So I don't remember how I got down this specific rabbit hole, but I do remember that I was thinking, we've spoken about mental illnesses with youth, teenagers, and then we've spoken about it with men, and then in other articles somewhere we'll just put like women in the I don't know, but I feel like I've spoken about all of it, and I haven't really touched on mental health with the elderly, with our parents and grandparents. Oh, I remember how I came across this because I was thinking about the conversation of forgiving our parents for not being exactly the humans that we wish that they could have been, right? And how, yeah, mental understanding their mental health could make us better at knowing how to relate with them. And then I was just like, but like also there's a lot of young ones that are taking care of their parents or grandparents that are struggling with their mental illnesses, and as a result this person also starts to struggle because nobody's looking out for them because the focus is so much on take care of this. So you know what I mean? So I'm just like, maybe if we just have a general better understanding of all these people that we're surviving with in society, we would know how to better help each other out. Makes sense, right? Okay, cool, because in my head that makes sense. So I found an article here by Life Path Group, I think. It really just goes straight into the article and I can't see. Life Path Group, yes. lifepathgroup.co.za. Alright, and this article was released on the 31st of May 2022. Elderly mental health, under the category of elderly mental health on their website, right? lifepathgroup.co.za. And the headline of this article specifically is helping elderly parents with mental health problems. Yay! Okay, helping elderly parents with mental health problems should be a priority since depression and anxiety left unchecked can become a severe issue. I think with just being on this I think I was about to say just being on this planet, and that's not what I was trying to say. I was trying to say just being on this channel, and then I thought, I'm like, well, you were about to say planet. Why did you say planet? Just being on this channel shows that we are inquiring about all things mental health wise, so we get that it's a severe issue. Okay, we will all grow older. Oh yeah, I keep forgetting about that. So it's not just about taking care of old people, it's also about that could be you sooner than you thought. We will all grow older and experience the unique stresses and issues of aging. If you are looking at a mental health clinic for your elderly parents, you must work with them and help them too. Oh, I think these are now being the points that then help you, right? Yeah, here are ways to effectively help your elderly parents with mental health problems. Exactly what we're here for, honestly. We're just trying to know what to do with them because we cannot be changing them at their big ages or helping them understand things. They're big at this age. So now we just need to know what to do with them. Cool. I'm fine with that, honestly. My own mental health stresses me out, so I don't find the necessity to overstress about my parents' ones. I care about it and I want to know what to do. How do I help and how can I be there for you? But I am no longer in the place of can I sit and it's help you change your thinking to be with this. That's a lot of work, but we're just trying to be healthy and happy and get along. Point number 1, keep calm with your elderly parents. I think the keeping calm part comes with remain respectful. It is natural to feel anxious or worried about the mental health of your loved one. Still, it is crucial that you stay calm and collected when speaking to your parent about their issues. Being overly anxious or even angry will make the situation worse. It could cause your parent to put up a barrier and stop speaking about their problems altogether. Which I completely understand why they would do that as a parent, why parents would do that, because there's a power dynamic, right? And naturally, an emotionally mature parent would want to be the ones that are doing that for you and get a little confused when we're now at a stage where you need to be doing that for them. So now you have to come to them with a different posture. I hope that makes sense. Sounds very churchy when I say that, but it's like, I hope that makes sense. Next trick in the book: maintain a support system for your elderly parent. Great. A significant factor in depression and other mental health issues can be loneliness. Completely believe that. I don't want to get too like, yeah, but I even think about the elderly that are so sick that they can hardly do things themselves, that it turns into, they end up having mental health issues because of just having chronic pain or another chronic illness that just makes it not easy for them to be themselves, the best selves that they know they used to be. And that's frustrating. It's already just frustrating as a person that is able-bodied and you're able to do anything and everything. It's frustrating when you have like a flu and you can't breathe properly, you know? So now imagine those type of issues being like everyday issues, and then we add on loneliness, which is a pandemic on its own. Oh, I worry about humans. Okay, providing your elderly parent or parents with as much attention and support as possible can be extremely valuable to them, helping to relieve the feeling of loneliness and abandonment. Yes, I think they're in a tough situation when they are elderly and, like, you know, because they want to be independent, but at the same time they realize that they need to be dependent on someone, and then the anxiety of, I might just be left alone because I'm now such a burden. And then they worry about being abandoned because they feel like they are a burden, and then they struggle with loneliness because of the same thing, and then it's depression, and then it's anxiety disorders. And how sad for our parents. You can work with your parents to create and maintain a support system that works for everyone. You need to be calm yourself, and you need to be ready for a normal conversation, and you need to calm down from wanting to make an argument with the parent, because you might be coming to them with a lot of information that they probably will see you are right later but not come back to you and tell you that you were right. And you need to be okay with that so that you can just get to the bottom of the situation of being like, how do we help you? It takes a lot of emotional intelligence to try to help somebody else. Okay, next point is make meal preparation easier for your elderly parents. Oh, this is beautiful. Assisting with meal preparation might sound like a simple act, but when an elderly person is depressed, they often stop eating, or eat tiny and unhealthy meals. Yes, this is a problem that they generally have even when they are not depressed. These grandparents are naughty. Sometimes, depends, but they tend to not be as easy on, like, eat, bro. Not eating can cause fatigue, extreme weight loss, and increased mood swings. Yes, and their weight loss fluctuates so quickly and easily, and it's scary. But okay, you can help your parent immensely by making their meal preparation more manageable and healthier. Okay, but I think that works because also not like fully doing every single thing for them, I think helps add on to the, you're still an adult and you're still independent, you know what I mean? And you're still my parent. I'm not going to babysit you. And that's not what I'm trying to do, you know? It still gives them their independence, but it has done enough. You've done enough to help them get somewhere so that they feel better about their little independence that they do have in that moment. You know? I like it. Talk openly with your elderly parent, not your adult parent. Talk openly with your elderly parent. I feel like is that part not a bit difficult? Because for the most part, we are hoping that our parents are the ones that are teaching us to be open. I think in an African household, that's not an activity you can just get up and get started with. Like, no, actually, we need a non-white human being to rewrite this article and give out tips again that we can work with, because these help, but there's something about it's different being African and or just non-white. It's just, it tends to be different, and when I'm in a rural area, even difficult, you know. But okay, I don't know why I talk to you about unnecessary things that I'm going to cut out of the video with my mic still close to my mouth. Like, I saw it every time I edit my video, and I'm like, oh. Last thing, baby. Last thing. But to talk openly with your elderly parent about their mental health issues, or combination of our parents. Which ones can we tell them about? Like, I think it's looking like bipolar right now, ma'am. And they will listen and do it.
Your father. My father.
Yeah, daddy might be easier. Daddy's the only one. In fact, this mama takes in information and she rejects it in the moment. But it's comfortable because we know she's gonna think about it and we'll discuss it again. The two problematic parents, those are yours. So you can leave with that conversation. If they attend therapy at a mental health facility, they will likely to be more willing to speak to you. Yes, because they would be more familiar with the language of anything that has to do with mental health, and also I think they would have already had a conversation about where their mental health struggles really are, so they'd be open to have that conversation with anyone after that. But if you're the one who's bringing up the fact that you're worried, and the worry isn't, I don't know, like diabetes or something, which already that is a difficult conversation, even if you suspect it. But like saying the worry is a mental, oh no, honey, that's not gonna work. However, be sure not to push your parents, yes, as this could come across as aggressive and disrespectful. They didn't put the disrespectful, but I think they wanted to put disrespectful, and they decided just not to do that. Getting help for your elderly parents. Let's come to this part as well. I love it when we conclude articles like this. I'm like, what are the symptoms? What can we do? And where can we go for help when we realize that we cannot be the only source of assistance? If you think that your elderly parent needs the help of a mental health profession, please WhatsApp or call LifePath Health's 24/7 helpline at 072 7900 506. I enjoyed that. Tell me what you think about it. Please go through the article as well yourself, and in the comments, let's have a discussion. I can't wait for the day when I say let's have a discussion in the comments, and I actually do end up having really multiple discussions in the comments. Like it's so cool, because right now I really am enjoying saying that, knowing there will be no comments. I will be lucky to get a view, but it's like I see my favorite YouTubers. It's just like, let's talk about it in the comments, and it's like I'm also gonna say let's talk about it in the comments, and then one day there will be a comment for us to talk about it with. All right, I'll see you in the next one.